Good afternoon, and thank you for the opportunity to present on this session number 12 of the World Climate Conference. The presentation is based on our perspective article titled Achieving Oral and Planetary Health, How Sports Dental Medicine Can Pioneer and Realize Transformation in Oral Healthcare. In this talk, I will argue that sports dental medicine can pioneer and realize a transformation in oral healthcare. It can act as a pioneering field of rethinking oral healthcare in line with planetary health, sustainability, and the broader transformation of health systems. It will briefly outline the burden of oral disease in elite athletes, the limitations of our current reactive care models, and then show how concepts such as sustainable oral health, planetary health, artificial intelligence, and minimum intervention oral care can be integrated into sports dental medicine to create a blueprint of future-ready, climate-conscious oral healthcare. Like all areas of oral healthcare, dentistry operates within what the United Nations and others describe as the triple planetary crisis: climate change, nature and biodiversity loss, and pollution and waste. Oral healthcare is not a marginal player. It consumes materials and energy and generates waste from disposable items and impression materials to energy-intensive clinical environments. Our key argument is that dentistry must be repositioned in decision-making fora from the local to the global level. We need to actively look for positive tipping points where beneficial changes to oral health systems become self-sustaining. Sports dental medicine, with its close links to performance, technology, and innovation, can offer an ideal environment to identify and leverage such tipping points in favor of both oral and planetary health. Despite being perceived as the epitome of health, elite and professional athletes show a high burden of oral diseases. Studies report substantial prevalence of dental caries, erosive tooth wear, gingival inflammation, periodontitis, and universal bruxism in some cohorts. These conditions are not trivial. They impair essential functions such as eating, relaxation, sleep quality, and even the confidence to smile, all of which feed back into performance and well being. The underlying risk factors are familiar: dietary patterns, frequent intake of sports drinks and gels, oral hygiene, challenges, and oxidative stress, and they are shared with non communicable diseases more broadly. Because athletes are closely monitored and highly motivated, they form a strategic population in which to develop, test, and refine more preventive, sustainable, and technologically enabled models of oral healthcare can later be transferred into the general population. Sports and exercise do not happen in a vacuum. They take place in specific environmental conditions that are changing due to climate change. Rising temperatures, heat waves, and altered humidity patterns increase the risk of heat stress and dehydration, which in turn affects salivary flow, oral microbiota, and caries risk. Greater UV exposure, higher levels of aeroallergens and air pollutants are more frequent extreme weather events and influence respiratory function and systemic inflammatory status. From an oral health perspective, these external stressors intersect with training load, diet, and recovery patterns. Therefore, sports dental medicine must adapt its assessment criteria and clinical protocols not only to the traditional risk factors but also to climate related exposures, both for athletes and by extension for the general population living under similar environmental pressures. Historically, sports dentistry has been framed around the prevention and management of dental trauma and oral pathologies linked to sports practice, often with a strong restorative and procedure-oriented focus. In our work, we argue for an evolution to sports dental medicine. And I think this is the key: a more comprehensive, system-oriented field. The WHO and FDI definitions place oral health within a broader framework and that includes breathing, chewing, speaking, and psychosocial functioning, and explicitly recognize the interconnections between the craniofacial complex and the musculoskeletal systems. This broader framing allows us to move from a narrow biomedical perspective to a model in which oral health is integral to perform recovery, mental well being, and long term health, and in which sustainability and planetary health are explicit goals rather than afterthoughts. Much of contemporary dental care, including in sports settings, still follows a reactive model. We intervene predominantly when diseases is already established. In caries management, this often means that early non-cavitated lesions are simply monitored, while treatment only begins when surgical intervention is inevitable. In periodontal disease, such an approach clearly contradicts best practice, which emphasizes early detection and active management. This reactive model is problematic for at least two reasons. First, it leads to late stage invasive and often repeated procedures, each associated with a significant ecological footprint, from material production and sterilization to waste management. Second, for athletes, it creates a recovery footprint with time lost from training and competition, and potential impacts on performance and team dynamics. In a planetary health context, continuing to rely on such a model is neither clinically nor environmentally sustainable. To overcome the inflammations of reactive care, we adopt the concept of sustainable oral health. This concept emphasizes that oral health is intrinsic to general health and human development from the earliest stages of life and across the life course. It also highlights a person's capacity to maintain oral health in the face of adversely trauma, stress, and environmental threats. In line with this, a salutogenetic approach shifts the focus from risk factors and disease to the resources, relationships, and environments that enable health. The Austrian and German associations for sports dentistry, for example, work with other sports medicine disciplines to promote models that strengthen athletes' resilience, support behavioral change, and embed oral health in a broader performance and well being strategies. This provides a tangible pathway for making oral health both health promoting and sustainable with planetary boundaries. The planetary health framework starts from the recognition that human well being depends on the integrity of Earth's natural systems and on staying within planetary boundaries. In the article, we adapt this perspective in oral health, proposing a model for oral and planetary health that explicitly contends environmental changes to oral disease risks, functional impairments, and inequalities. Sports dental medicine is well positioned to operationalize this model. The field is already familiar with concepts such as load management, environmental exposure, and performance optimization. By integrating environmental considerations such as carbon footprint, material cycles, and waste into routine and oral healthcare for athletes, we can demonstrate practical ways in which dental practice can become environmentally responsible, socially accountable, and economically viable. These lessons can then be translated to general practice to support a broader shift toward sustainable dentistry or in extension medicine. Artificial intelligence has major potential to power the next generation of oral health services, particularly in a highly monitored environment such as elite sports. In our work, we describe an AI driven platform co developed by sports dental societies and clinical partners that integrates multiple diagnostic modalities, including multi wavelength intraoral scans, intraoral OCTs, CBCTs, salivary biomarkers, and mRNA analysis of oral microbiome. By linking these oral health data with musculoskeletal, respiratory, and metabolic parameters, AI systems can provide nuanced risk profiles, guide preventive interventions, and monitor changes over time. This enables early, minimally invasive management and reduces the need for duplicate examinations and resource intensive procedures. Crucially, AI can help sports dentists transition from being primarily diagnosticians who respond to problems to becoming specialized oral health coaches who co create long term sustainable performance and health strategies with athletes and sports medicine teams. Minimum interventional oral care provides a coherent framework for sustainable practice. It starts with early detection and robust risk and susceptibility assessment, then prioritizes non-invasive and micro-invasive measures to prevent and control disease. Only when strictly necessary does it proceed to minimally invasive operative interventions, and it closes the loop with personalized recall and active long-term surveillance. In sports dental medicine, this approach fits naturally with regular screening and performance monitoring. Parallel advances in biomimetic materials, such as self-assembling peptides for animal and entine remineralization, and in non-ionizing imaging technologies like digital infrared translumination intraoral OCTs, further strengthen the case of low-impact regenerative care. Together, MIOC and biomimetic technologies can reduce the clinical and ecological burden of treatment while enhancing athletes' experience and long-term oral health. In our article, we map sustainable AI-enhanced approaches in sports dental medicine onto the WHO Global Oral Health Action Plan. Early detection, minimally invasive care, and active surveillance directly contribute to reducing the number and invasiveness of clinical interventions and to improving restoration longevity. Integrated digital workflows and AI-supported information systems address WHO priorities around better data, fewer duplications, and more efficient use of resources. Finally, the inherently team-based nature of sports medicine promotes interprofessional and transdisciplinary collaboration, which is central to addressing the social, commercial, and environmental determinants of oral health. Thus, sports dental medicine can serve as real-world testbed for the WHO Action Plan, generating evidence and models that can be adapted and scaled in broader oral health systems. To conclude, let me highlight four key messages. First, elite athletes, despite their fitness, carry a high burden of oral disease and are exposed to climate related stressors, making them both vulnerable and strategically important for innovation. Second, sports dental medicine offers a powerful bridge between oral health, athletic performance, sustainability, and planetary health, and can therefore act as a catalyst for change. Third, the integration of artificial intelligence, minimum intervention, oral care, and biomimetic technologies provides the practical tools needed for delivering low impact, high value care. Fourth, by explicitly aligning our work with the planetary health agenda and the WHO Global Oral Health Action Plan, we can ensure that innovations in sports dental medicine contribute to broader system wide transformation. My call to action is simple. Let us use sports dental medicine as a pioneering field to co design future ready oral health systems that protect both people and the planet. Thank you for your attention, and I look forward to your questions. We have, I think, afterwards talking around with questions and answers. If somebody wants to connect, here is my email address. I would be glad to answer all of your questions. Thanks a lot.
First, I'd like to extend a special thanks to Julian Fisher, whose work and impact has been truly foundational for advancing a sustainable and equitable global oral health. I'd like to express an institutional acknowledgement from Agas University in Portugal to Penn Dental Medicine for organizing these outstanding events. And our president sends warm congratulations for this exemplary humanitarian initiative, and also reaffirms our openness to future collaborations dedicated to the health of our planet. My name is João Botelho. I'm a WHO consultant for oral health. I'm a GBD senior collaborator member and the head of the Translation One Medicine Research Group at Agas Research Center. And today I'll address, as agreed, the Minamatic Convention and to discuss where the evidence currently stands regarding the mercury-free dental products. From there, I will pave the way for our next lecture that I'll be honored to introduce my colleague André Judis and how sports dental medicine can, as Stavros said, serve as a real-world model to test and accelerate sustainable transformation within oral healthcare systems. So we are living in an era of climate, digital, and social transformations that challenge every health systems, including oral health. And oral healthcare is not an isolated practice. It sits within health ecological limits, as Professor Fisher and colleagues said, the donut model. So if we exceed those ecological boundaries, we undermine not only planetary health, but the very determinants that make good oral health possible: nutrition, water, housing, and education. And as emphasized in this fantastic review, the triple planetary crisis exists: climate change, biodiversity loss, and pollution waste. So when we talk about improving oral health, we are talking about indeed safeguarding the planet. And from the perspective of a global oral health to planetary health finally leads to a One Health approach that combines human, animal, and environmental health in a single ecosystem. So climate sensitive risks like heat waves, floods, and air pollution don't stop at the clinic door. They alter disease patterns, they stress healthcare infrastructures, and they widen inequalities in access to oral health services. So if oral health systems ignore these dynamics, they risk becoming both victims but contributors to climate instability. And focusing on the belaying statement from this Global Oral Health Conference, I will focus more on the protective prevention, which calls for the adoption and implementing a planet-centric, health-centric as well, model for oral health services and care. And these are not abstract principles. They call for a fundamental redesign of how we teach, how we practice, and how we research oral health. A clear example is the Minamata Convention on Mercury, which is transforming dental materials and practices worldwide. So this year, the WHO presented its new guideline on environmentally friendly and less invasive oral health care for caries prevention and management. And the goal is very clear: to move away from mercury-based amalgam toward mercury-free materials. We are talking about resin composites, glass ionomers, and ceramics. So this transition, despite necessary, is not impact-free. Replacing mercury eliminates one hazard, but will introduce for sure new ones associated with synthetic polymers, nanomaterials, and microplastics. And this Minamata Convention document states for 5 clear key research questions that I will endeavor in the next few minutes. So we are talking about the clinical effectiveness and cost effectiveness of mercury-free products compared to amalgam. What's their different cytotoxicity and biocompatibility or not? To what extent are monomers and nanoparticles released into oral environment? What are the health effects of using these new materials? And finally, what are the environmental effects? These 5 key research questions were developed from the involved teams with this Minamata Convention on Mercury, and they are ongoing right now. But one might argue, what is the current evidence before we can have a more enlightening information from these reviews? In a nutshell, we have these 5 questions going on, and I will try to make some kind of futurology based on the current evidence to guide the attendees on how we may expect the results from these research questions. For the first one, mercury-free restoration materials, a summary of the evidence. A Cochrane Oral Health umbrella review addressed this point, and they found 3 reviews comparing resin-based composites, RBC, and dental amalgam. On the one hand, the difference on restoration failure may be 7 percentage points less with dental amalgam. They used 2 primary studies, over 3,000 restorations, and studies between 5 to 7 years of follow-up, but there is low certainty evidence. So what this means is that failure may not be significantly different between dental amalgam and resin-based composites. Important note is that those studies began in late 1990s. And as we know, composites have evolved tremendously, and they are completely different from these original studies. So they may not extrapolate to the contemporary evidence in other reviews right now. Similar evidence was found in other 2 reviews, now those from very low certainty of evidence. And these were, when we say low certainty of evidence, is based on the methodology employed. And one review also reported non-different post-operative pain and discomfort between these two materials. So at this stage, we may expect some similarity and non-inferiority between resin-based composites and dental amalgams. Regarding cytotoxicity and biocompatibility of these mercury-free dental products, evidence is not so clear, but in vitro study in 2001 found a slight difference of 1 to 7-fold higher cytotoxicity from amalgams compared to dental composite components. However, they must emphasize that this was a short-time model, and the authors found that dental amalgams were in fact safe to be used. In the third question about to what extent the components of mercury-free dental products release into the oral environment, they found that despite they are less environmentally impactful, they also release monomeric and other substances, and they act as contaminants, and they interact with biofilms. So they have a certain effect on the oral mouth and oral physiology and homeostasis. Regarding the health effects, today we have a lack of evidence. So I cannot tell you what are the health effects for those who work with these kind of materials and also for the patients. And lastly, what are the environmental effects? And for the environmental effects, there is a very interesting review that I invite all to read from Sustainability. They say that the shift to mercury-free materials beyond the environmental improvement comes with a cost. So despite we are eliminating mercury hazards, these introduce new environmental challenges from synthetic polymers, ceramics, and nanomaterials. Let's find out more. Water pollution risks. Resin monomers and BPA, for example, can leach into wastewater during dental procedures or restoration removal. So these components can persist through conventional filtration, potentially harming aquatic ecosystems and entering the food chain. For air pollution, for example, the incineration of polymeric resin and nanomaterial waste emits toxic gases, dioxins, and micro nanoparticles. And the combustion of residues can also contain heavy metals and bioactive particles, hazards to air quality and wildlife. The landfilling leads to leachates with organic and inorganic pollutants such as the BPA, cadmium, lead, nanoparticles that can contaminate soil and groundwater. And these substances may be non-biodegradable and persist long-term. And regarding wildlife and ecosystem effects, they released nanoparticles and resin-derived monomers that exhibit toxicity to microorganisms, plants, and aquatic species. And the bioaccumulation through water and soil pathways affect both terrestrial and marine life. Lastly, there is a waste management challenge. We currently have filters that were designed for amalgam mercury, not for nanomaterials or polymer debris. And there is a need for rethinking recycling and filtration technologies to recover materials and minimize the incineration and landfill use. Now, why sports dental medicine? Because it's a microcosm of modern oral health. It involves high-performance materials, prevention-driven care, and a culture of innovation. Athletes are indeed ambassadors of behavioral change. They show how oral health directly impacts systemic performance, nutrition, and resilience. And by embedding sustainable practices, such the examples I discussed previously, sports dentistry, as Stavros said, can pioneer a real-world model of transformation, and it can bridge the gap between performance and prevention, between clinical success and environmental responsibility. So as take-home messages, oral health and planetary health are inseparable, and a sustainable, equitable oral health contributes to achieving the UN 2030 Agenda and planetary health goals. Sports dentistry offers a real-world testing ground. The transition from amalgam to mercury-free materials is necessary, but I warn that it is not impact-free, as we saw previously in this presentation. The current evidence on mercury-free materials, long-term safety, performance, and environmental footprint is low to very low certainty. There is a lot to be done in the next few years, and the transformation to mercury-free, environmentally friendly dentistry must balance clinical effectiveness, human safety, and planetary sustainability. And sports dental medicine can indeed lead by example. Thank you so much for your time.
So, good evening, everyone. It's a privilege to join the fourth Global Oral Health and Climate Action Conference during COP13 here in Belém. And I want to beginning by expressing my sincere honor to share this section with distinguished colleagues such as Travels and Tillman, people I have the pleasure of knowing personally and learning from. And to thank Professor Julian Fisher for this invitation, which I truly appreciate. Today, I want to bring a deeply practical perspective of sports dentistry, particularly in collective sports such as football and basketball, provides a real world setting where prevention, anticipation, and sustainability are not theoretically principles but daily operational realities. High performance sports forces us to adapt quickly, act effectively, and prevent rather than react. This is, in many ways, the perfect living laboratory to test the future of oral and planetary health. Let me briefly introduce myself. My entire professional activity is ensured in a practical reality of high performance sports. At Tegos Muniz, I am head of the sport industry department, where I work directly with elite and professional athletes, football, basketball, athletics, and sport combats, managing oral health, functional challenge, and season-depending vulnerabilities. But perhaps even more importantly, for today, my PhD is fully centered on elite athletes. I study how oral health, functional determinants, and athlete centered outcomes interact with performance, recovery, and system loads. These works generates the kind of evidence that WHO highlights in section 2.1, risk patterns, environmental influences, efficiency in healthcare delivery, and prevention-based strategies. Alongside, I collaborate internationally with societies across Europe, Brazil, and India, and coordinate the postgraduate course in sport industry at Egos Muniz, where we train future professionals to work with athletes in truly multidisciplinary teams. So, what I will present today stems from two complementary pillars. First, scientific evidence from my PhD research, and second, the lived reality of working every day with athletes who operate at the highest competitive level. When we talk about planetary health, oral health is not a side topic, it's a center indicator. Climate stress, digital transition, social inequalities, and the new food system are already reshaping healthcare. The WHO guideline makes it clear the future of oral health care must be preventive, resource efficient, digital enabled, and really resilient to environment pressures. Oral disease feel the impact of climatic extremes, dehydration, access inequalities, and nutritional shifts, making them a sensitive sensor of planetary change. And by this model, by Fisher et al., shows how interconnected people, planet, education, care delivery, and environment limits truly are. Sport industry is an exceptionally powerful testing around this concept. Why? Because everything in athletes is accelerated. Physiology, routines, travel, environmental exposure, and competitive rhythms. Oral health becomes a direct and immediate reflection of planetary pressures and an ideal laboratory to test preventive, sustainable, and digitally supported solutions. Taking a wider view, oral health is moving from biomedical paradigm to planetary health and One Health perspective. We now understand that oral health sits between environmental boundaries and the social foundations, exactly as shown in the Dalton model. Fisher et al. Highlight that oral health cannot be isolated from the broader ecological and social context. It must become a component of planetary resilience. This is especially relevant in my PhD research because elite sport is exactly where these pressures converge. Environment exposure, physical stress, behavior insanities, and social demands all collide in athletes. Sport provides an extremely rich environment to test new preventive models and to study human-planet interaction in real life. Athletes are a sentinel. population. They expose often in exaggerated form the tensions between well-being, performance, and sustainability. High performance does not equal all else. In every cohort we study, we see the same pattern: frequent travel and secondary disruption, acid sports drinks, dehydration and inflammation, rapid nutrition cycles, physical stress. This combination mirrors planetary health stress, but at a much higher speed. Athletes experience in weeks what in general population experiences in years. This acceleration allows us to map risk patterns, environmental influences, and behavioral drivers with clarity and extremely valuable from the public health. And the data confirms it. After London 2002, the Netherlands study showed 50% had active carries, 40% had dead involvement, 45% had erosion, 55% gingivitis, and 18% reported negative on performance. If athletes with medical, nutrition, and physiotherapy supports present this disease burden, the conclusion is clear. They are a high risk group structurally exposed to oral disease. And for high risk groups, prevention is the only sustainable strategy. Sports dentistry is built on three pillars that reflects both performance needs and sustainability principles. Prevention, early diagnosis, continuous monitoring, and tailored protocols reduce disease and minimize resources heavy treatments. Protection, through custom course trauma prevention and functional stabilization, we avoid complex injuries and reduce treatment burden. Performance, maintaining oral stability to avoid system stress and performance decreasements, always in close dialogue with medical and performance teams. These three pillars are from a model that is proactive, sustainable, and interdisciplinary. We and aligned with the direction of the WHO sets for the future of oral care. A central part of my PhD work is understanding seasonality, how oral health risk changes across pre-season, competitive cycles, travel, and recovery. Our published paper showed that caries, erosion, and inflammation remains consistently high, but the expression fluctuates across the season. This matters because timing is everything. Intervening at the right moment, especially pre-season, reduces disease progression, maximizes athlete receptivity, and lower resource use. Season planning also allows us to evaluate entire squads efficiently in one coordinated block, reducing materials, equipment, travel, and environment footprint while increases preventive research. Our scientific report study examining clinical findings, values and quality of life in elite athletes from different sports. Disease burden was high, but what was even more striking was how it affects sleep, concentration, training quality, and overall being. This aligns perfectly with WHO Section 2.1, which prioritizes research on human behaviors, values, function impact, and risk exposure. Understanding these dimensions allow us to design preventive, resource efficient, and human-centered care pathways. We included 114 elite athletes, a robust and diverse cohort. We use the European Association for Sport Industry protocol, the first study to apply it in elite sports. Standardization is key. It enables compatibility between sports, season, and countries, which exactly is the type of harmonization that WHO recommends for building sustainable preventive systems. Our results showed that more than half of athletes had multiple pathology findings, but awareness was low, a mismatch identical to the global populations. This reinforces athletes as a high-risk population requiring target, early and preventive policies to reduce invasive care and development impact. Sport industry functions as a circular model. Athlete prevention, research, protocol optimization, this cycle allows us to continuously refine timing, prevention, and sustainability, fully aligned with planetary health principles and the WHO foresight. EA is a major step forward. It accelerates diagnosis, improves accuracy, and allows us to build predictive models. Early detection means fewer complications, fewer invasive treatments, and far lower resource consumption. And EA also enables us to screen large groups of athletes in a fraction of the time, making prevention scalable and much more sustainable. These technologies directly shape our clinical workflow at Egos Muniz. We can examine entire teams quickly with fewer appointments, fewer materials, and less travel. This is what patient-centric thinking looks like in practice: smarter diagnosis, lighter process, higher research, and lower impact. Digital workflows allow us to produce precise protective devices, muscular trays faster and with minimal waste. These reduce material, remakes, and environment burden while fitting perfectly into the tight schedules of athletes. Performance, the more we measure, the more evidence we generate. And the better we support athletes, standardized protocols allow us to evaluate entire squads, personalize strategies, and improve quality of life. Better oral health, few resources needed. This is evidence-driven sustainability. This is our protocols in Egos Muniz. So, sport dentistry is not a niche. It's a working model for the future of the sustainable oral health care. Prevention reduces resources use. Digitalization expands access. Interdisciplinary aligns oral, systemic, and environment health. This model works in a demanding environment of high performance sports. It can work anywhere. The future of oral health will be defined not by how much we treat, but how well we prevent and how responsibly we use our resources. Thank you for this opportunity at the COP13. It was been a privilege to share this work alongside João and to share with Stavros and Tillman. And my sincere thanks to Professor Fischer for the invitation and for the leading this global movement towards sustainability, prevention, and driven oral care. Thank you so much.
I go a little bit more deep in the sports dentistry. My aspects are the ecotoxicological aspects in sports dentistry, and thank you to Stavros especially. My part is a little bit go deeper. Stavros were talking about the Austrian Society of Sports Dentistry. We are the Austrian Society in Europe, in Austria. It's not Australia. Please don't mix. That's why it's very important. Come to my topic. Dentistry is connected with ecotoxicology, and ecotoxicology is a big topic. It's a big topic on this session also, and let's go deeper to the FDA definition of the oral health, yes, it's a combination of the habits, it's a combination of the welfare. One aspect in this is a little bit less explained. It's the angst, it's a fear. It's a fear we find nearly in 30% of the population, and these are the reason why the dental needs, the treatment needs are increasing. I think there are two main factors we're faced for. It's a part of nutrition and the non-formulated part, the soil pollution because of the fear because of dentistry, what is happening when you get a treatment in the dental chair. And these are parts we could change. We could change with sports dentistry because we can show the mouth is a place of healing. And that's very important. It's a small book I wrote years before. And this is a part we can change sports dentistry to a communication platform. And that's my mission for sustainable oral health, that we use sports dentistry for a new formulation, for a new communication with our patients, to show them, yes, it's a biophysiological, spiritual perspective, and we all are the same. In sports, there are no differences. We have the same social, the same economical, and the same environmental factors. All we are one family. We are one sports family. We are one sports dentistry family, and that's a new field. A new field we can use sports dentistry to go closer. Stavros and me, we are traveling around since more than 20 years and trying to get a standard, to getting a formulation to go deeper with the patients and make a little bit dentistry a little more common. And we found out sports dentistry is the easiest platform to communicate with people, and that's our chance. That's our chance to communicate dentistry, to communicate the possibility of oral health in population, to get popular. Dentistry has to become popular, that we don't have the fear for treatment. And when it's common, then it's easy. We made a systematic in sports dentistry, and we had 3 pillars: toxification, silent inflammation, and dynamic function or neurobiological function. These are the 3 pillars in sports dentistry we are running in our systematic. And today we go a little bit more deep in toxification, a little bit deeper in toxification, to get it as a communication platform to the patients, to the possibility to communicate about dentistry. And we have toxificator. We have toxificator in the anthropogenic artifacts we are using every day, we are using on our patients, and these artifacts are quite a lot. Today, I don't want to waste your time. That's why I want to start a little bit with the problems with our environmental problems of plastic. Dentistry becomes plastic. We are running in a plastic dentistry. And that's a problem, the ecotoxicological problem we face with our toxificators, because there are 2 sides. One side that we produce we produce aligner splints, mouse guard, night guard, and so on and so on. The production changed. In former times, you see on the right side on the slide, we were using rock models, and we were using some resins. Okay, you see the resins were quite toxic, but nowadays it changed. It got more plastic. Now we print it, we mill it, We do a lot, and these are changing factors. Yes, changing factors when we produce something for dentistry to use it at our patients on the right line. I show you a line what we need, that we produce aligners for our patients. It's a big mess, and for the technicians it's a new field, because they are using toxin substances, and they have higher loading of fumers during the production. The fumers of the printers are quite very toxic. New plastic, dust, nanoparticles, microplastic, and so on, and so on. The ecotoxicological effects in producing dentures, splints, are higher. We are in a plastic dentistry, and when we use it, we have a bigger amount of disposal, and that's new. That's why this aspect is not a good development in dentistry, and we have to think about how could we think about in the future to reduce it. But nevertheless, when we use these plastic toxificators in the oral cavity, we are attacking the microbiome, the oralium. What is the oralium? That's a communication between hosts. It's a communication between the dental artifacts and the oralium. We call it oralium, and so on, in interaction to the mind, mouth, body, soul, spirit. So you see, it's very complex what we touch on with our toxificators, and in the end of the day, there's a new field of disposal. These are some ideas I wanted to share with you for the following discussion, and I think sports dentistry is a place of communication. I'm so happy that we had the Minimata, and I'm so happy that we were talking about mercury in the Minimata, and thank you so much, Andre, for your lovely presentation. It was so interesting to see the comparison. I only want to highlight in Europe, just Germany, mercury is forbidden since 1st of July, 1st of January this year, and we have a intermediate interim plan in some countries, but it's right. And when we are talking about mercury, we are talking about metals, and that's why we can use sports dentistry to show different toxificator and the relationship to the performance of our athletes. And we are talking about metals. My grandfather was one of the first toxicologists in dentistry, and he was talking about galvanism. Galvanism is not very well formulated in dentistry, but we can use sports dentistry to talk about it, because when we have ion loss, we have a deep impact to the whole metabolism because of the corrosion. We have a ion loss, and that's why we have an electronic change. The biofilm is changing, some nerve transmission, and so on. I don't want to go in the detail. And when we have the ions, we have all of them metabolic impact, and the most communication part is inflammation, the currencies and NF-kappa B, and so on and so on. I don't want to go to the detail. And mercury, it's a very old style. Sorry, Justin. We know 50% of amalgam is contained by mercury, and by the way, the ecotoxicology is quite a wide field. We only have not resources from amalgam filling. We have from seafood, from air, water, and vaccinations. But 10% of the mercury in the environment comes from amalgam filling. It's a big amount, and that's why now we face a bioaccumulation. Why bioaccumulation is so important? Because it's an increasing factor, and when we have mercury inside in the environment, there is it inside, and that's its reality for the future. And that's why this slide is very important. WHO were talking about in 1991. That's quite a long time. And the intake of the resource were nearly the half of the intake of mercury in the metabolism. That's why I wanted to emphasize it a little bit in this slide. But that's a item because there's a big difference. It's a big difference. You have 24 hours, 365 days a year, some toxin in the oral cavity, or you eat a fish. That means you have subtoxic amounts. We are facing item of hormesis, and this is a quite completely different impact of the metabolism than a one shot of toxins. That's another field of ecotoxicology that we face. The dose is different, and hormesis will be a dose relationship we have to talk in sports dentistry in the next years. And why mercury is an example because not only mercury, all other ions of metals have nearly the same impact. They go from the oral cavity in the internal organs, and they are delivering nearly all organs we have in the whole body. And what do? They do a mimicry effect, and that's why they go deep in the metabolism, the enzymes, in the channels and receptors, in the pump lipids, and so on. And so it's very deep. And there are amplifiers. Amplifiers, that means that other ingredients could amplify the interaction of mercury and so on. The mixtures of different metals also could amplify this. Just even testosterone, that's an impact for sports dentistry, could amplify the mercury metabolism. And some side effects are very well known in the literature. In the end of the day, to jump to the sports dentistry, what is doing mercury, it goes in the mitochondria. Mitochondria are very important in sports, in athletes, because athletes use it very well to produce ATP, and ATP is, for example, the mitochondria are in a higher loading, nearly 70% of the volume in the heart. That's why the interaction, the relation between the mercury load and the interaction to the metabolism is higher risk in athletes than us normal people. In the end of the day, heavy metals cause inflammation, cause immunity activity, and they go in the mitochondria, and that's why it's cell hypoxia, deleting the ability to produce energy. And I think that's the easiest way to talk about these fields, these interactions, to make a communication platform to the patients, because now it's very easy to understand. That's why we try to avoid amalgam fillings in our athletes. Coming back to the Minimata were also considering about glasiomer and composites. I only want to emphasize in one or two slides the problems we face. We were talking with Julian before, and now we are talking about a plastic dentistry. We are talking about new problems, and I think we have to face that we try to reduce the risk factors by reducing the fare, optimizing the nutrition to avoid dental problem in assets. And that's why sports dentistry is a platform to communicate with it. And we have two parts. We have the nanoparticles aberration and so on from the composites, and another part it's a metabolism with the monomers and so on. So these two parts are completely different. We have a toxification, and with the nanoparticles aberration, we have a function problem. And these are the two factors we have to communicate in the future together with the ecotoxicology in dentistry. So all the resins, all the composites will be the ecotoxicology 2.0 in the future. Thank you very much to all. I want to share with you my ideas. Maybe we can go in discussion, go deeper, how we can use sports dentistry as a communication field to improve the oral health, the sustainability of the oral health, the sustainability of the health, because the oral cavity is the key of healthiness. Thank you very much.
Yeah, hello from Germany, from Lake Constance, and very happy to be here and part of it. And today I would like to present integrative sports dental medicine, connecting physiology, performance, and prevention, an interdisciplinary approach for the dental practice. First, I would like to introduce myself. I'm 36 years old. I'm a dentist for 11 years now, and I'm holding a master's degree in interdisciplinary dentistry. Beyond, I'm a sports dentist. And since 2020, I have my own practice in Lindau at Lake Constance. That's a short overview about my practice. I have a team of 19 employees, and we're working in 6 treatment rooms and have an integrated dental lab. And additionally to my dental work, a physiotherapist and a medical doctor are part of our daily work. And my main task is TMD therapy and functional oral rehabilitation. This is a key team of our work field. I have an oral surgeon in my practice and endodontist, and also a medical doctor and a physiotherapist. And we, of course, work together with other doctors we need for this patient. This is why oral health and sports dentistry gain more and more importance in daily practice. Dentists in Germany are among the most frequently visited healthcare professionals, even by individuals who consider themselves healthy. This regular contact allows dentists to identify oral diseases early and prevent systematic health consequences, such as cardiovascular and metabolic diseases, chronic inflammation and infection, oral manifestation of systematic disorders. And due to this unique position in primary care, dentists can also detect signs of skin cancer or suspicious lesions around the oral region, cardiovascular infectious diseases with intraoral symptoms, worse microbiome and reflux, or mouth breathing. Also, studies show that there is a correlation between oral health, heart disease, mouth cancer, diabetes, lung conditions, strokes, and gum disease. To understand what sports dentistry is all about, let's have a look about the 3 key factors in sports dentistry. First, the therapy of injuries like dental trauma and oral surgery. The second part of sports dentistry is the elimination of performance disruptive factors. These are caries, teeth loss, malocclusion, bad posture, microbiome, inflammation, and bad chewing capacity. All these points are influenced each other. Once we eliminated the performance disruptive factors, we can work on performance improvement and tuning. In my therapy, I'm focusing on 4 factors: performance blend, optimizing nutrition, optimize occlusion, and improve regeneration. Therefore, it is mandatory to optimize it. in order to increase athletic performance, not only for high-performing athletes, but for everybody. In the following, we look at the practical side and interesting cases of different patients for interdisciplinary dentistry. We've built structured protocols that apply to every patient, from those with chronic dysfunction to high-performing athletes. To give you a brief look into my practical work, I'll present the following 3 cases. And this is part, for example, for a functional analysis. I use a cheat and fill it out. First, a professional athlete. In the following cases, I show how sports dental medicine not only enhances performance, but also severe as a model for sustainable integrative oral health care. This is Ariane Redler. She's an Austrian ski racer, and she came to my dental office just because she was grinding and pressing her teeth and has noises in her joints. She has also chronic pain in the on the left side, and from her leg and also in her shoulders. Every time we are doing an extraoral status, also with the posture, and yeah, you can see there a lot of head position, for example, is a little to the right, or the shoulders on the left is a little higher, and so on. And we are also doing, of course, an intraoral status with pictures and also, yeah, normal dental status. Then with a muscle palpation, I can detect if occlusion is involved and has an impact on, for example, the posture or the diseases patient are coming to the practice. This was, for example, at August 2023. And yeah, then I'm doing a diagnosis and find out that she has asymmetric body posture, and I look at the extraoral and intraoral status, and of course the dental status, and so on. Also radiographic X-rays, yeah. And then I'm doing a treatment plan, and in this case it was first filling therapy because she has a little decay, and then we are doing a condylography. You see a picture of it on the sheet, and at first, I'm doing a muscle relaxation splint with front canine guidance and osteopathy, and then afterwards, performance splint after functional adjustment. These are just a splint production, and then she, or we insert it, and she has to wear it in the night. And this was the first splint, the relaxing muscle relaxation splint. And she has to wear it at night and as often as possible during the day. And then, of course, I do a lot of adjustments, appointments, and equilibration of the splint. And also every time I'm doing muscle palpations. Afterwards, when I was very happy with the situation, I did a bite and we produced performance splint for her. And this is a performance splint in her mouth. And this is extraoral status after splint therapy. Before you saw the picture before of the cheeks, and there's a after picture. We did it, I think, last week. She has a splint inside, but I think everybody can see she has more relaxed smile line, more symmetric, and she's feeling very, very, very happy with it, and has more power, and did better skiing races, and yes, she's better now than she was before the splint, and she really appreciated the splint for her profession. Then the next case, the second case shows a normal sporty woman. She has massive pain in her back and shoulders and lack of energy, and she came to my practice with this main concern. She's only 33 years old and a professional singer, and she was recommended from another patient, and she's really like, oh, I have so much pain. I want to cut my nerves somewhere in her neck. I really do not know what they want to do there. That she have less pain. And then we also did a medical history, of course. And there you can see she has a lot of pain in her back, and also shoulders and arms are involved, and her knees and her lower back and so on. And then I'm also doing a medical history, very detailed, and extraoral status again, and an intraoral status again. Muscle palpation. Here you see when there's in the muscle palpation a double or 3 pluses, it's pain. Double plus is pain, and 3 pluses is I just touch the area and they feeling pain. So there was pain extraoral and in jaw joints and also intraoral. Afterwards, treatment plan. First, of course, condylography and lateral ceph, and then splint therapy. And because of her pain and so on, I would like to have an interdisciplinary checkup, and maybe, if needed, a full mouth rehabilitation, maybe minimal invasive preparation and therapeutic position, or orthodontist. Then splint insertion, and of course a lot of equilibration, and this is the first, and I compared to the in pink in the last appointment. This was then 3 months later, and you see there she has really less pain, she has more energy, she feels great, and she has no pain. I was really pressing my muscle points, and she really had no pain there. I also did a extraoral status after 3 months of the splint therapy, and I think you can see it's not the best picture, the best first picture, because she wears her blazer, but her arm has a different position, and also her body status on the right, she has a better balanced position and less tensed muscles. And also here, the extra, the face pictures, you really see her relaxed face muscles, and she feels now alive again, and she's very happy with it now. And now we start with more interdisciplinary work. These are the next therapeutic steps: medical checkup, also mitochondrial deficit, and maybe also adrenal glands, because of her, she had a lot of stress before. And maybe we need physiotherapy, but we will see then. And we plan a full mouth rehabilitation with orthodontic treatment, and maybe additionally some non-prep fusions. The last case showed that sports dentistry is also for every patient, not only for high-performing athletes, because this is a 70-year-old woman, and she's retired now. She owned a pharmacy before, and she was a professional dancer, also a little more sportive then. And she came to me with an enormous amount of dental knowledge, and she was very, very in acute TMD, pain in her cervical spine, tinnitus, tired, and lack of energy. And that was a really main concern, uncoordinated gait. And she has to look to the ground while walking. And before she got new crowns in a different practice, and she felt that her gait is getting worse. And before, pain in her left lower jaw, then new crowns and lots of occlusal adaptation where before, and fractures of the upper, and yeah, a lot of more. And also there I did a medical history, a very detailed one, and also here you can see she has lots of chronic pain, also in her left shoulder, in her lower back, and she has headaches. They start in the neck and then go up to the whole head. This is the extraoral status. You can see she's not very straight. She has a for example, there the shoulders you can see a lot asymmetric. Then the intraoral status. Then the muscle palpation in May 25. The left and the right side also. There's a lot of pain in the extraoral and intraoral and jaw joints and so on. And the treatment plan also was condylography, lateral ceph splint therapy, and then also interdisciplinary checkup because she has fibromyalgia and hormone disbalances, and yeah, physiotherapy every week, I think 2 times every week. And yeah, before she had a full mouth rehabilitation, but I think she needs new prosthetics now, and afterwards maybe an eye splint. Then muscle palpation before and after splint, because then we did the splint and adaptation of the splint and yeah, everything you have seen before. And this is now the therapeutic position we are choosing. And you see at the beginning she had pain everywhere, and now she really gets of her pain. I think she goes to her physiotherapist every 2 weeks maybe because of other problems, but she's very happy now and has less pain, and yeah, I'm really happy that we can help her with only a splint. Then the extraoral status after and before splint therapy, and I think everybody can see she's more relaxed and has less wrinkles and better head posture and more shiny eyes. It's like this was before and after. It's really like she's also alive again. And also this, I think you can see here the posture changed a lot. The feet she is using not for balancing her feet the whole time, and she has a better leg posture, and also her whole body posture is much better. She's more in center, and yeah, now she also said she has a better gait again, and she feels very, very happy with it, and yeah, can do more than before. And the next therapeutic steps, they are medical therapy, because she has mitochondrial diseases also and Lyme disease, and it's a re-inflammation of the Lyme disease because of her stress, also her dental stress, and yeah, maybe also orthopedic checkup, and then final restoration in the right therapeutic position. After reviewing these 3 sports dentistry cases, I want to highlight what every dentist can apply in daily practice. Especially the new FDI definition reminds us that oral health is a fundamental part of physical and mental well-being, shaped by our experiences, values, and ability to adapt. This means that the principles used in sports dentistry are not just for athletes, but relevant for every patient across the entire continuum of oral health. I think that every dentist, even without a specialization in sports dentistry, can apply the following diagnostics and treatments to assure good oral health in order to achieve a sustainable healthcare to reduce the environmental footprint. People first. We treat the whole person, body, mind, smile in harmony. And structured individual care, evidence-based protocols for every patient, from chronic dysfunction to elite athletes, interdisciplinary and integrative, functional therapy, sports dentistry, and systematic health working together, from repair to regeneration, understanding courses, restoring balance, and promoting lasting well-being. Sustainability in practice, modern dentistry that links oral health, body performance, and planetary health. And that brings me to my conclusion. I see dentistry at the crossroads of health and sustainability because of interdisciplinary collaboration. When such findings occur, dentists can refer patients to general practitioners or specialists, ensuring timely diagnosis and holistic care. Sports dental medicine offers a unique entry point to connect oral health, human performance, and planetary health. By integrating prevention, precision, and sustainability, dentistry positions itself in key decision-making arenas, from local policy to global health planning. Then public health relevance. This makes dentistry not only a discipline of teeth and gum, but a critical gateway for systematic disease prevention and health promotion. Thank you.